guys, hello. We are going to get into some certification prep today. Do me a favor and let me know in the comment section if you're watching a replay or if you're currently watching live. Let me know in the live chat where you are tuning in from, and also let me know what your status is. So comment down below and let me know if you are a student currently, if you just finished school for medical assistant, if you're already a medical assistant. Let me know where you fall in. Chime in below, check in as you guys are coming in. I'm just doing something on my end really quickly. Let me know exactly where you guys are in your journey, where you're located, and also where you are in your journey. Also, let me know what certification you're about to take as well. Um, let's see. Let me go here. Let's see. All right, we're gonna go here. I'm just sharing something in the chat, doing something from my phone really quickly while you guys are doing that. Okay, Dallas, I'm a student now. Okay, awesome, Georgia. And let me know, guys, what your status is as well. I see my YouTube people chiming in, Facebook. Make sure you guys are chiming in as well. Um, okay, I see you guys. Okay, preparing to take certification. Okay, awesome. I'm starting clinicals 8:31. Okay, so this is good to know. This is good to know. So for those of you that are new here, my name is Kendra, aka Miss K. I became a medical assistant in 2004, and I became a medical assistant instructor in 2011. And these are the study videos that I do is to help you prepare for certification. Okay, so how we do these, I'll show the question. If it's your first time joining live, I'll show the question on the screen, and then I'll give you guys a couple seconds to answer. Okay, and before I move on to the answer. Okay, let me see. And this is going to be a subscribers chat. So if you are a subscriber on YouTube, you will be able to join in on the chat. You can still watch whether you're a subscriber or not, but to be a subscriber on YouTube, to comment on YouTube, you need to be a subscriber. So make sure you guys subscribe if you haven't already. If you're watching on Facebook, obviously you already follow me. If not, make sure you do so, and also on YouTube as well. All right, guys. So one thing I do want to let you guys know, especially for those of you that are new here, I do have a MA refresher course. I'm going to put the link in the chat and I'm going to pin it. This is for anybody. You guys know I do these free videos, of course, on YouTube when I have time, but then I also have an online study guide for you guys. So as you can see on the video, there are quizzes in there. There's over 400 practice questions. So if you happen to watch tonight and you're like, listen, I need some more of this, then you want to get my online study guide, my MA refresher course. Okay, so I'm putting that in the chat right now, online study guide, and then I'm going to pin it for those of you guys that are on YouTube. Okay. Oh, Jennifer says from UDC. That's exactly where I was teaching. Wait a minute, Jennifer, Jennifer, email me ASAP. I need you to email me ASAP, Jennifer. Jennifer is one of my old students. Shout out to Jen. Jen, I need you to email me ASAP, okay? Because I have been trying to get in contact with you and your class because I've had so many things to update y'all on. Jen, send me an email ASAP, like now. Please, thank you. Shout out to Jen and all of my old students that chime in here and there. Thank you, Jen, for chiming in. I'm so glad to see you. You just made my night. All right. So, and you guys can hear me, right? I just want to confirm. Let me pin this comment on YouTube so that way you guys can, yeah. So I just pinned the message for anybody who needs an online study guide, it's marefreshercourse.com. I also linked it in the chat. Okay. Also, if you're an MA or you've been in the field for a while, you want to get some experience as a business owner. You want to start a CPR business, or you want to sell scrubs, or you want to just figure out, what kind of business can I start as an MA? Like what kind of clinical, what can I do to use my clinical skills to make some money outside of the clinic? I have an ebook. It's called Beyond the Clinic. It's a blueprint for anybody who wants to start a business. Like I walk you through how to actually start, how to figure out what you want to do, and actually how to even start a business. Like I walk you through all of that in this ebook, and it's only $9.99, guys. It's only $9.99. I made it super cheap, super affordable for you guys. So I'm linking that as well, the ebook. Yes, Jen. Yes, please email me. All right, guys. So without further ado, let's go ahead and get into it. So I just wanted to point that out to you guys, my MA refresher course, as well as the ebook for anybody who wants to make money outside of the clinic. All right, let's get into it. All right. A patient reports chest pain and shortness of breath while waiting for the provider. What should the medical assistant do first? What should the medical assistant do first? So you notice the patient, they're waiting for the provider. They say, I have chest pain. My chest is hurting. I'm feeling short of breath. What should you do? Should you tell the patient to relax and continue to room your other patients? Should you notify the provider immediately? Should you give the patient aspirin without an order? Or should you schedule the patient for a later appointment? Let me know in the chat, guys. And let me fix this here. See all messages. Okay. All right. I see the answers coming in. All right. So this is a pretty easy one, right? Because you guys already know anything urgent, you want to let the provider know immediately, right? What's some other symptoms that will make this even more urgent? Let's say the patient is short of breath, they're having chest pain. What other symptoms do you guys think maybe, will make this even more urgent? So the chest pain, shortness of breath, anything else you guys can think of, let me know in the chat. In the meantime, I'll go to the next question. Which vital sign should be reported immediately for an adult patient? A temperature of 98.6 degrees, a blood pressure of 118/76, a respiration rate of 8 breaths per minute, or a pulse rate of 76. Yeah, somebody said fever, okay. Sweating, yep. Which vital sign should be reported immediately for an adult patient? The temperature, the blood pressure, the respiratory rate, or the pulse? Let me know, guys. All right. If you say the respiratory rate, you are absolutely correct, because a respiratory rate of 8 breaths per minute is super low for an adult, right? And requires immediate attention. Now, the normal adult respiration rate is going to be 12 to 20. Now, depending on what piece of literature you look at, sometimes it'll say 12 to 20. Sometimes it'll say 14 to 20. Okay. But usually it's going to be the 12. All right, before performing venipuncture, what's the most important first step? Labeling the tube, applying the tourniquet, identify the patient using 2 identifiers, or ask the patient to make a fist. What's the most important first step? And just a quick tip for those of you that's preparing to take your test, this is going to be one of the biggest things too when you guys are reading these questions, paying attention to keywords, right? What's the most important first step? So you'll see options, and you'll say, wait a minute, I have to do all of those things. But what do you do first? What's the most important? What do you do before anything? And if you said C, absolutely, you're going to identify the patient using 2 identifiers, right? And what 2 identifiers? You guys should already know this, the name and date of birth, right? Those are going to be your 2 identifiers, always name and date of birth, okay? All right, which tube is used for CBC? Red top, light blue top, lavender, or gray for CBC, complete blood count. Let's see. Do I got any Facebook people chiming in today? I don't see any Facebook people chiming in. I wonder if it's actually live on. If you're on Facebook watching right now, do me a favor and comment, because I don't see anybody. I am live on Facebook, but when I try to post the link to my refresher course, it wouldn't post. So I wonder if Facebook is even working right now. If you're on Facebook while we're waiting for everyone to answer this question, just do me a favor and put a comment in the chat. Better yet, put your answer in the chat. All right, let's see. Okay, so for CBC, it's going to be lavender, okay? And they contain EDTA. So just remember, guys, when you are taking your test, Sometimes it may give the color, but then sometimes it may just name the tube, the additive that's in the tube. So instead of saying lavender, or light blue or gray, it may just say EDTA or sodium citrate or sodium fluoride or oxalate. So sometimes it will not give the actual the color of the tube. It'll just have the additive. So make sure you guys know the additive that's in the tube, right? And then also what type of testing is done in that tube. For an example, hematology testing is done in lavender. Which action follows standard precautions? Wearing gloves only when the patient looks sick, recapping needles after injections, treating all blood and body fluids as potentially infectious, or skipping hand hygiene if gloves were worn. Which of the following actions follows standard precautions? Yeah, I don't see Facebook chiming in at all. While you guys are answering that, I'm on my phone as well. Let me just go look on Facebook and see if I'm even live over there. Let's see if it's showing up on my page. Okay, so okay. I see the comments. Okay, so Facebook, I do see the comments directly on the Facebook app. Oh, actually, no. Let's see. Okay, so yeah, Facebook is actually working. Okay. All right, so let's go to the answer. Let's see. Okay, so if you said C, absolutely. Standard precautions, you treat all blood and body fluids as potential infectious. Like you treat everybody and everything as if it's infectious, right? So we're not going to not wear gloves. I'm sorry, we're not going to not wash our hands because we use gloves. We still have to use hand hygiene. We still want to use gloves for a patient, even if they don't look sick, right? And what are two examples of PPE? You guys go ahead and put that in the chat as well. Give me two examples of PPE, personal protective equipment. All right, a provider orders 500 milligrams of medication, but the tablets are 250 milligrams each. How many tablets should be given? 1, 2, 3, or 4? The provider orders 500 milligrams. You go to the medicine cabinet and the medication is not available in 500, but it's available in 250. How many should you give the patient? Now, of course, some of you are going to look at this question and say, wait a minute, this is too easy. It doesn't matter. Don't worry so much about the numbers. Just focus on the formula. So even if you look at it and say, wait a minute, that is too easy, always look at the formula, okay? So if you say 2 tablets, yes, but what's the formula? What formula do we use? It's going to be what the doctor ordered divided by what you have on hand. So D over H, right? So the doctor ordered 500 milligrams. You would have divided by 250 that you had on hand, and that will give you how many tablets you need to give the patient, okay? Now, when you have a liquid medication, so let's just say it had said 500 milligrams, and then the doctor wanted 500 milligrams, and then you went to the medicine cabinet and it was available in the liquid. It may have said 250 milligrams per 5 milliliters. In that case is where the Q come in to the formula. So you guys have probably seen D over H times Q as well. That's when you're dealing with milliliters. That's when you're dealing with liquids. But when it's just tablets, it's simply D over H. When you're dealing with liquids, it's D over H times Q. And I'm going to do a separate video. I do have some videos on dosage calculations already, but I'm going to do another video on that, just an updated video on that, just for anybody who's maybe new to the channel. So just remember the formula. Which EKG lead is the most commonly used to monitor heart rhythm during a standard 12 lead EKG? Lead 1, 2, AVR, or lead V6? The most commonly used when the heart rhythm is being monitored. Yeah, Kayla says 250 by 5. Exactly. So just remember the formula, guys. And then once you know the formula, all you're doing when you go take your test, you're just plugging in whatever numbers they give you. So the biggest thing is knowing the formula. So even though you might get some numbers that's super easy, still work your formula out just so you make sure you're familiar with it. All right, so if you said lead 2, you are correct. So it's commonly used for rhythm monitoring because it provides a clear view of the atrial and ventricular activity. Okay. Now, if you happen to see an artifact, what should you check? Somebody let me know in the chat if you are doing an EKG and you notice an artifact. Now, when you go take your test, they may describe they may describe the artifact, or they may actually show you pictures of an artifact, and you may have to label the artifact. So you make sure you're familiar with the artifacts and also what to do if you see one. So what do you do if you see an artifact? You're doing an EKG, you notice artifact, what do you check? While you guys are putting that, I'm going to go to the next one. A patient becomes dizzy during a blood draw. What should a medical assistant do? Continue quickly to finish the draw, remove the needle and ensure patient safety, tell the patient to stand up, or leave to find another patient. Oh, somebody says, I don't really remember learning EKG. Yeah, so the good thing is that with EKG, Kayla, you don't, this isn't an EKG tech class, so you don't get too deep into EKG, but you do, that is one of the things you do need to know, basically, how to recognize artifacts, your EKG placements. I go over all of that in my MA refresher course that I have linked as well. All right, so let's see. So if you chose B, you're correct. So if the patient feels faint, you want to remove the needle, activate safety, and apply pressure, and protect the patient from injury, okay? Now, what position do you think you would maybe put a patient in who feels faint? So the patient says, I feel faint, or I feel like I may faint, or they may even say, usually when I get my blood drawn, I usually faint. What would you do? What would you do? Let me know in the chat as I go to the next one. All right, which of the following is a correct example of therapeutic communication? You should not worry about that. I know exactly how you feel. Tell me more about what you're feeling. Well, that's not a big deal. Which one is correct when you're dealing with therapeutic communication? So yeah, if somebody says supine or semi-filed, a semi-filed definitely. If somebody's feeling faint, you want to put them. So one option that it may give you, it may just say, lie the patient down. If a patient tells you, that they are feeling faint, it'll say lie them down to draw their blood. Or if it gives you actual positions to choose from, yes, it'll be the semi-filer. Yep. Tell me more about what you're feeling. Yep. You want to have an open-ended question, right? And then you don't want to necessarily, you don't want to say, I know how you feel, right? You just want to encourage them to talk. Okay. And then why should we avoid false reassurance? So false reassurance is like, everything is going to be okay. It may not be okay. We don't know, and we're not allowed to let a patient know that it will be okay. So you want to avoid false reassurance. Which document gives a patient information about how their health information may be used and disclosed? Is it going to be the CMS 1500, the Notice of Privacy Practices, Advanced Directive, or a referral? So this is the document that lets patients know how their information may be used and disclosed. Lets the patient know we're going to keep their information private, but this is how we're going to use it and disclose your information. Okay, I see the answers coming in. Yep, Notice of Privacy Practices. It explains how protected information may be used and disclosed under HIPAA. Okay, and PHI is simply protected health information. Most people say patient health information, but it's protected health information, okay? All right, which injection angle is most appropriate for an intramuscular injection? Is it 10 to 15 degrees, 25 degrees, 45, or 90? Intramuscular injection. Intramuscular injection. Okay, so if you said D, you're correct. 90 degrees. Yep, 90 degrees. All right. And then also, if you guys don't mind, what are some common intramuscular injection sites? If you don't mind listing some, maybe somebody else is watching and maybe, maybe need to know some common injection sites for intramuscular. As you guys are putting that in, let's go ahead to the next question. Which position is commonly used for a pelvic exam? Prone, lithotomy, Sims, or Fowler's? Make sure you guys know those positions. Sometimes they may show you pictures of the positions, or they may just ask you about them like this, where they'll name certain, type of exams, and you got to know which position is used for that exam. Okay, so if you said lithotomy, you're correct. That is when the patient is lying down on their back and the feet are in the stirrups. And it's okay. Someone says, "Oh no, I hope I pass this." And so, for anybody that's watching and you're going along, if you're getting anything incorrect, this is even more reason for you to add it to your notes. So once I'm done, this video is going to stay up, so you can always go back and watch the replay. You can watch it slower if you need to, or fast forward or whatever. But I do recommend going back and watching the replay, so that way you can kind of, just use it to add to your notes anything that you're realizing you didn't know. Because if you're watching this and you're like, oh man, I'm realizing I'm getting these answers wrong, this is why I do these videos. It is okay. This is helping you to realize where you need to focus. All right, a patient asks a medical assistant to interpret lab results. What's the best response? Are you going to explain what the abnormal values mean? Give medical advice based on the results? Tell the patient that the provider will review the results, or are you going to compare the results to another patient's labs? So the patient says, can you tell me what my lab results mean? What are you going to do? What's the best response? Another key word. Okay, what is the best response? Okay, I see the answers coming in already. Yeah, exactly. You want to tell the patient that the provider is going to review the results. It is outside of our scope as a medical assistant to interpret results. Now, there may be some times where the provider may give you, permission to give them the results, and that's different, but you should always let the patient know that the provider will review the results. Okay. Now, as an MA, part of your job may be calling patients with results, and that's different, as the disclaimer that is down at the bottom of this page says, always, review your employer's policy. So especially if you're in a private office, you may actually have the freedom to let patients know what the results are. When I worked in GYN, I was in a private office. We knew that especially when they were normal, we could give the patient results. But some actually, some employers actually, even when it's normal, they don't want you to say anything until they tell you to. So always follow your employer's policy. Now, what are some things the MAs can say without giving advice? What's something that an MA that you think an MA can say without giving advice? Of course, this is one example. The provider review it in a moment. You can even let the patient know, I'm sorry, I'm not able to go over the results with you, but the provider will be right in. Sometimes the patient even say, oh, that means it's abnormal, don't it? I've had patients ask me that, oh, you can't tell me that means it's bad. No, not necessarily. It's just that, it's the policy here that MAs cannot give the results unless the provider tells me to. And that's it. All right, which medical term means difficulty breathing? Dysuria, dyspnea, dysphagia, or diplopia? Dysuria, dyspnea, dysphagia, or diplopia? Why can't I say diplopia? Diplopia. Okay, let's see. If you said dyspnea, you are correct. Dyspnea means difficulty breathing or shortness of breath. All right, what is the first step in the chain of infection? And I do want to give you guys an update about this question too. I'm gonna let you guys answer, but I do want to talk about this in a second too. because there's been an update to the chain of infection. Does anybody know the update to the chain of infection before I even get into it? Does anybody know what has changed about the chain of infection? What's the first step? Is it mode of transmission, portal of entry, infections agent, or susceptible host? Let me know the answer. And also, guys, let me know if anybody knows what has changed about the chain of infection. There has been an update about the chain of infection. Okay, and this is why I want to talk about this, because I noticed that I think, yeah, I see only one person got it correct. The infectious agent. So this is what I want to talk to you guys about. So remember, there's always been 5 links in the chain. So now there are 6 links, okay? So that first link, they are referring to as the actual infections agent itself. So like you guys know before, the first link, and depending on what you look at, is still going to say 5 links. So I don't want you guys to be surprised. It can be 5 or it can be, it may be 6. It just kind of depends, okay? You won't ever have to choose between the two. So I don't want you to be afraid, oh man, what if it says, reservoir host and infectious agent? Like, which one is first? You're not going to have to choose between the two, because it's a newer update. But the first link is now infectious agent, which is the actual bacteria, virus, fungi, or parasites. And then the second link is going to be the reservoir host. So remember how the reservoir host was first, right? Now it's second. Now the first is the actual infectious agent itself. Okay, so that's where it starts. It starts with the bacteria or virus, fungi, or parasite, whatever it is, right? And then the reservoir host gets infected. And then, of course, the portal of exit, how it exits the body. And then the mode of transmission, how it travels to the next person, right? And then the portal of entry for that person. And then the susceptible host. So let me say that one more time. I think I may have said portal of entry twice. So you got the first link, which is the infection agent. That's the bacteria, virus, fungi, or parasite. Then you have the reservoir host. Then you have the portal of exit. I'm sorry. I think the first time I said portal of entry. That third link is going to be the port of exit. That's how it exits the body. Okay. Mode of transmission is the vehicle. That's how it travels to the next person. Okay. So let's say I sneeze. That's my portal of exit. I sneeze. One of my droplets gets on the desk, right? Somebody comes by and touches the desk. That is the mode of transmission. That's how it travels to them. Then let's say they rub their nose or they eat something. They didn't wash their hands. And now it has entered their body. That is a port of entry. And then now they are the susceptible host. So I wanted to make sure I go over that with you guys, because I know there's probably going to be some confusion. There has always been 5 links in the chain, but now there are 6. Okay. All right. Which of the following is an example of objective data? If the patient says, I feel nauseated, a patient reports a pain level of 8 out of 10, a temperature of 101.2, or the patient says the pain started yesterday. Which of the following is objective? Which of the following is objective? Okay, I finally see some Facebook people chiming in. Okay, I see Kenyatta. All right. Oh, I see one Facebook person actually. Okay, Facebook. Not much going on Facebook tonight. Okay. All right, let's see what you guys are saying. Yep. If you chose temperature, you are correct. So objective data is what you can observe or what you can measure. Okay. So that temperature that you measure is 101.2. That is objective. Okay. Now, it's, subjective is everything else that was mentioned on the previous slide. I feel nauseated. My pain level is 8 out of 10. It's what your patient tells you. Okay. All right, which abbreviation should be avoided because it can be mistaken for another order? Milligrams, milliliters, U for units, or PO? Which abbreviation should be avoided because it can be mistaken? Which abbreviation, which of the following, what do you guys think? Which one should be avoided? Yep, Josie says the rest were subjective. Correct. Yep. Congratulations, Benidra. And congratulations to everybody who has commented that they passed their exam. Congratulations, everyone that has recently passed. Okay. So this is going to be the U for units. Everything else is okay to use. Milligrams, milliliters, okay? What was the other one? PO by mouth, but units is one. Just write it out. Don't put U, just write units out, okay? Now let me ask you guys this. What can be dangerous about using certain abbreviations? The question kind of answered itself. That's because it can be mistaken as something else, you know? Which organ produces insulin? Liver, pancreas, kidney, or spleen? Which organ produces insulin? The liver, the pancreas, the kidney, or the spleen? Okay, I see the answers coming in. Yeah, the pancreas produces insulin, which helps regulate blood glucose levels. And what condition is related to insulin problems? Most of you guys probably know this one, but just to make sure, what condition is related to insulin problems? Which specimen must be protected from light? Bilirubin test, CBC, PT-INR, or urinalysis culture? Which of the following specimens must be protected from light? Bilirubin, CBC, PT-INR, or urinalysis? Yep, diabetes. I see you guys putting it in the chat. Correct. All righty. I see your answers coming through now. Okay, so it's going to be bilirubin. The other tests are not light sensitive, okay? But bilirubin specimens are light sensitive and should be protected from light to prevent inaccurate results. Now, what can happen if the specimen is not handled incorrectly? So you guys working in the lab, you get handling instructions. Some things have to be protected from light. Some have to be, some have to remain room temperature. Some need to be refrigerated. What can happen if you ignore those handling instructions? Let me know in the chat. The patient has a blood pressure of 160/98. What should you do? Should you document it and notify the provider? Should you let the patient know that they have hypertension? Should you ignore it if the patient feels fine, or give them some medication from the sample closet? You guys probably know this. Yep, an incorrect reading. Correct, Diane. You can get an incorrect reading, absolutely. Okay, I see the answers coming in. And you guys, we kind of talked about this earlier, so you already know. You got to notify the provider. You of course document it, and then you notify the provider. All right, got a few more here. Which type of scheduling allows several patients to arrive at the beginning of each hour and be seen in order? Wave scheduling, double booking, open hours, or cluster scheduling? The patient is seen at the beginning of the hour, and then they are seen in order. Okay. Yep, I see your answers coming in, guys. It is wave scheduling. They group patients to arrive at set intervals, maybe let's say 9 o'clock, beginning of the hour, and then they come in and they're seen as they come in, okay? So when might double booking be appropriate or risky? So when can double booking be appropriate and when can it be risky? Okay, so the difference between double booking and wave is that with wave, the patients are seen, of course, within an hour, but there's enough time allotted for that. When a patient is double booked, they're both in the same time slot. There is no, time allotted within the hour. They're just both in the same time slot. But sometimes it's appropriate. When is it appropriate, and then when is it risky? Let me know in the chat. All right, which part of the SOAP documentation includes the provider's diagnosis or impression? The subjective portion, objective, assessment, or plan? the provider's diagnosis or impression, like what he or she thinks is happening. Okay, y'all are quick. I see the answers coming in already. Yep. The assessment section. So what goes in the plan section then? So if the diagnosis, impression, or interpretation of the patient's condition goes in assessment, what goes in the plan section? What goes in the plan section? Now that may be something you may see, asked about. What goes in the plan section? That's an example of when I say make sure you guys are studying the wrong answers as well. And when you guys go over the replay, and you're, watching it maybe a little slower, you're taking notes, make sure you take notes on the wrong answers as well, because you'll see that asked about. Okay, which technique is used to sterilize instruments using steam under pressure? Sanitization, disinfection, autoclaving, or antisepsis. So you sterilizing instruments using steam under pressure. All right, correct, Guyana, prognosis and treatment. All right, let's see. I see your answers are coming in, guys. Y'all are moving fast tonight. Y'all must be ready to go to bed and get off here. Autoclaving, yep, uses steam under pressure to sterilize instruments. And guys, make sure you know the difference between disinfection and sterilization. And I'll just let you guys know. So disinfection is it does not kill everything. So it'll kill some pathogens and render some inactive, right? It does not kill spores though. Sterilization destroys everything, all microorganisms. Okay, so disinfection will kill some pathogens and render some inactive, but not the spores. And then sterilization destroys all microorganisms. All right, which pulse site is most commonly used for routine adult vital signs? Femoral, popliteal, radial, or dorsalis pedis? Most commonly used for adult vital signs. One second, guys. Why is it? Okay, let me share again. Sorry, guys. I just noticed something. I just noticed an typo. Let's see. How do I share that again? Okay. All right, let's see your answers coming in. Okay, if you said radio, you are correct. A patient has a suspected stroke. Which symptom should be treated as urgent? Sudden facial drooping, mild seasonal sneezing, chronic knee soreness, or occasional dry skin. So a patient you think the patient is having a stroke. What symptoms should be treated as urgent? I did not realize. This is why I should have looked over everything one more time. Okay, let's see. Okay, so if you said sudden facial drooping, you are correct. Sudden facial drooping can be a stroke warning sign and requires immediate emergency response. Okay, guys. So if you have any questions, let me know below. Make sure if you haven't already, make sure you subscribe. Also, don't forget the MA refresher course. I have it linked. I'll do some more of these soon. If you want to let me know your score in the chat, let me know how many you got right or how many you got incorrect. You can let me know in the chat. Make sure you like the video if you enjoyed, especially for those of you on YouTube. Let me see what else. I think that's it for now. You guys, I'll stick around for a couple more seconds just to see if you guys have any questions at all. Thank you, Miranda. Miranda says, I love your videos. Thank you, guys. I wanted to go live for a few minutes. I haven't been live in a while. When I tell you guys, I literally just threw this study session together. Literally, that's why I had a couple of things I needed to fix on it. I literally just threw it together maybe like an hour, couple hours ago, and I said I need to go live tonight and do a study session because I have not been on here. So hopefully this was helpful to you guys. You know, like I said, I'll stick around a couple more seconds, see if you have any questions. Diane says, thank you, Miss K. You appreciate it. I just started my program. Oh, awesome. I'm glad so you're already here. Don't get too overwhelmed with the study session videos, Diane. And anybody else that just started, try not to focus too much on certification stuff yet, but definitely watch the skills videos. And don't forget, guys, if you're preparing for certification and you need a study guide, make sure you go to marefreshercourse.com. It is in the pinned comment on YouTube. Diane says, I'm in Pittsburgh, but it helps. Okay, I've never been to Pittsburgh. I've been to Pennsylvania plenty of times, but I've never been to Pittsburgh. That was my father. My father loved, I don't know what it was about Pittsburgh, but that was like his spot. Whenever he needed to get away, I don't know who he knew there, where he was going, but that was always his getaway, Pittsburgh. I've never been though. All right, guys, so I don't see any questions coming up. So I'm going to go ahead and end this. The video is going to stay up. So if anybody needs to rewatch, this is going to stay up. If you're watching on Facebook, it does not stay up past 30 days, okay? So if you're watching on Facebook, you know, you got 30 days and you got to come over to YouTube. Kayla says, what should I do if I didn't really study much and take the exam soon? So Kayla, you can consider getting my MA refresher course. So in the course, let me just play this again. So this is a video of how it looks here. So in the course, I am teaching lessons here. If you can see that video, and then there are quizzes there. And this is how you can kind of know where you are, what you know, what you don't know. After each lesson, there's a quiz. And then at the very end of the course, there are practice questions as well. Okay, so I would consider that if you, especially if you don't already have the study material. And then also, as you were watching us, as you were watching this, Kayla, if you started noticing that you are, you're realizing that, you're kind of falling behind in certain areas, you want to really study that topic, so for an example, if you watch tonight and you realize, oh wow, I didn't know anything about EKG, or I didn't know anything about phlebotomy, you want to make sure you're really honing in on that topic. Okay. What else? Yeah, so study material, consider my MA refresher course, study material, of course, watching my videos, and then honing in on your areas where you've realized you have fallen short. And good luck to Laura and anybody else that's about to take your test. Laura's is taking hers tomorrow. So good luck to all of you guys. I'm looking forward to your messages and your comments, letting me know that you passed, you got this. Make sure when you're taking your test tomorrow, Laura, that you're flagging or bookmarking any tough questions, any questions that you need to spend time on. Flag it and come back to it later. Okay, pay attention to your keywords and your questions. Use process of elimination. And hopefully, as you were going through this tonight, hopefully you realize, oh wow, I know more than I thought I did. So hopefully this was a good session for you. Okay, guys, that's going to be it. I'm going to go ahead and end this. I am super tired. Like I said, I wanted to just do this really quickly, but I am beat. So I will see you guys. Oh, I'm going to go live tomorrow night for sure. So I did mean to let you guys know that. So tomorrow night, I don't know what time yet, but I'm going to do a Friday night live, and I'm just going to be chilling on live with you guys. So if you have any questions, bring them tomorrow night. I just don't know what time yet, but I'm definitely going to be going live tomorrow night for Friday Night Live. Maybe about this time, maybe about 7 or 8 p.m., maybe a little later, maybe about 9. We'll see. But make sure your notifications are on YouTube so you're notified when I'm live, okay? All right, guys.